Hello, welcome, EriXpress viewers. We're here for month of celebration of Women's Day, and here with the dynamic woman, Dr. Hanaa Hamdi. Welcome again. Thanks for coming. Dr. Hanaa, can you tell us a little bit about yourself?
Sure. Thank you so much for having me. I'm excited to talk to all of you today. My name is Hanaa Hamdi. I'm Eritrean, born in Eritrea, Asmara, and my family left the country and moved to the United States. So I've been in the U.S. and I was educated elementary school, junior high, high school, and college, and graduate school in the U.S. My professional sort of profile, I'm a social epidemiologist in training in clinical and social epidemiology, and simultaneously I have a degree in urban planning. So my work is at the intersection of community development, impact investment, and population health. I am the oldest in my family, the oldest girl. Growing up, my family was very important for us, as Eritreans, to be educated, to be successful and then to contribute to our community. And so that has been sort of my North Star and my guide along the trajectory of my career.
How did you get into this career? Was there an inspirational story to it? Was there something always that you wanted to be? How did you get into it, and how was it? Could you tell us in detail?
Sure. So I didn't really have a linear career path. Being the oldest immigrant family, the first one to go to college, the path wasn't always clear, but as all immigrant families, we have three choices: you're either a medical doctor, an engineer, a lawyer. And so what I did not want is to go into treating sick people. That I've always known, but I was always interested in population health. That was very clear to me. I just didn't have the language or the intellectual guidance to pursue that. And so in high school, I excelled in sciences, and in college, I actually started out as aeronautical engineering, and then the department closed. And so that was my opportunity to tell my father that I wasn't going to be an astronaut, right? And so I shifted gears and I majored in neuropsychology, and with the understanding of just, how people make health decisions. That's always been sort of the drive for me to understand what makes people healthy, or how do they exercise the choice or the choices that they have. And so after college, I had an opportunity with a fellowship to go to Harvard Medical School and work at the Mass General Gillette Center for Women's Cancers. And during that time, I was working on a research project. It was a longitudinal national study of 5,000 women looking at just stages of cancer and how they present to clinic. And while it was a clinical study, I began to look at a subset of data just to look where the patients with the severe cases or the advanced stages of cancer were coming, and if there are any unique characteristics or common grounds. And what I found is, particularly in the population that came out of the Boston, women that were Mattapan, Dorchester, and Roxbury, regardless of education and income, all presented with advanced stages of cancer. And also their decision making was quite different. And so all women, right, and all choosing to delay their treatment. And so that was a sort of the combination of where they came from and why and when they chose their treatment was really intriguing to me. And so at the time I was on my path to go into medical school, but still that light wasn't there. It was sort of just following what my parents wanted, what society sort of just tells you, this is health, this is medicine, this is how you care for your community. And then right after that, I had another opportunity to work at Columbia Medical School at the Center for Liver Transplantation. And it was a longitudinal study that looked at comorbidities between HIV and hepatic liver cancer, or liver cancer among Black men or Latino men, primarily, incarcerated. And so I began to look at the social demographics of all the patients and just looking at, like, how do you get into this, into this work? And just around the same time, I took a course with this brilliant professor at Harvard, Paul Farmer. And the first thing that he said is that HIV is not, biological. It may manifest, but the pathway to it is very social. It's a social disease. And that was a trigger for me. And so I paused my applications to medical school, and I started to look into graduate courses at both Harvard and Columbia and Hunter College. And I found this advanced course in community education. That was it for me, right? And so I took the course and began to think about, how do people really make health decisions in spite of or because of their environment? So this concept about 80% of our health really happens outside of the clinics or hospital corridors really resonated with me. And so I started to look at the built environment and the connection to health. And then around that time, I was like, I think I'm just going to get a PhD and look at this intersection of built environment and health. And that was it. And I've been very blessed. I've had many brilliant women who kind of guided my career trajectory to help me to get to where I am. And so that's really my path. And so, being Eritrean, my parents were expecting a medical degree. But, I think they were okay with having a joint PhD in urban planning and public health. It's still a little bit confusing to them that I teach at a medical school and I'm not a medical doctor, so they're still trying to figure that piece out, but it works.
It's a many years of, staying focused to accomplish what you accomplished, especially in terms of the education side and choosing the different schools and changing basically a whole different from engineering to a medical. Was there times that you just wanted to give up and find the easy way or change completely from these two? Or was there an instance where someone really pushed you so that you can do it, especially from our Eritrean community or anyone else who was a woman? Like, what made you stay on your track?
No, absolutely. And I think there's something to be said about being Eritrean. That's the gift that carry. We're very determined, right? My family came here. We overcame many obstacles in that, right? The fact that they came here, they gave up everything that was really good for them for us to come here and be able to contribute in the way that, that has a meaningful, impact on who I am was really important to me. So the career path for me wasn't necessarily to find a job. I think we can find jobs, right? But I wanted to find something where I could be really impactful, right? Something that really resonated with how I see the world. And so, of course, there were times where I couldn't pay tuition, right? And you're calling family and friends and amazing, in Boston, I had this amazing Eritrean family who, allowed me to take shelter in their apartment while I finished school, right? But there was one particular story, which fortuitous, the timing of it. The study that I mentioned at the Gillette Center for Women's Cancer, one of the first patients that I had an opportunity to interview was actually Eritrean. And she's since passed away from the cancer, but she presented with stage 3 cancer. And she pleaded with the doctors and the residents in the room to not tell her family, right? So that stuck out with me. And I think as women, right, our everything supersedes our health, right? Particularly for an Eritrean woman. It was important for her, like, her kids went to school, that her mother, and her family's care was taken care of, even knowing, or, with the consideration. And this is a well-educated woman, right? But that was a trigger for me. And so how do you create opportunities for women to not have to sacrifice their own health, right? And it's part of it's this social conditioning, right? So how do you get away from that? But then how do you remove those obstacles so that you don't have to work 2 jobs to take care of your family while you're dying from cancer? So that has always been a motivating factor to keep pushing.
Definitely, especially Eritrean mothers are known to keep their family at any cost from anything. It doesn't matter what comes, like you said, even if it's a personal health problems or anything else. But for you, it must have been really motivating and significant to have you as an Eritrean patient as well. That stuck out with you, the story, yeah?
No, absolutely. And it touches you differently. I mean, cancer touches us as human beings, but then when it's someone that speaks your language, that, you're in the exam room with the medical doctors, and you can hear what she's saying, and the doctors are, and this gets to the other sort of why I teach in medical schools, right? It just being, and so when she says, "Oh yes, my stomach hurts," that it's not literal, right? And so that disconnect between language, right, and cultural competency was there and very palpable for me at the time. And I was like, okay, this is something that I need to change. I just didn't know how to fit it into my line of work, particularly because I was so focused on the environment where people come from, right? So the neighborhood conditions, the availability of healthy homes, food that's healthy and affordable, open space, climate change. And so all of that doesn't really or easily translate into how we negotiate our health in the exam room, right? And so it was until many years later that I was able to kind of carve out the space where I can teach medical students about where their patients come from. So they are not just, a medical record number, or they're not, people who come from that neighborhood, but because of where they come from, there's a particular history, a nuanced history where they need to consider, if at all, available, bring in someone who can speak that patient's language, right? And I mean, we're getting there, we're not there, but that's how I really navigate the 2 different fields for me. Is that clear?
Yes, very. Even personally, I really would like to connect when I go to a doctor on a personal level, not only medically, but him understand, or him or her understand where my reservations are when I'm saying things. Like I said, not everybody we're comfortable expressing exactly what we feeling or don't know exactly how to put it. So to have someone that kind of diverse cultural background is very important. It's key. And I agree. I admire that. So we're going to go to your accomplishments now. We heard you accomplished humbly many things, but own it and tell us, what was it? What were they?
So I've been very fortunate, Maroti. Everywhere I go, I find the most amazing people who help me really get things done and get them done in the way that they should be done, so that at the end of every project or job that I do, it's always about lifting the community, particularly women's communities, right? My core belief is that as women, we're architects of communities, and if women are not healthy, the community is not healthy, right? So that's the premise from where I operate. And so between 2014 to 2017, I served as the health director commissioner of city of Newark in New Jersey, and it's the largest city and obviously the largest health department. And it was also around the time that the global epidemic of Ebola, was happening. So that was an experience to work very closely with residents from the African diaspora at the time. The stigma of the Ebola virus was as deadly as the virus itself. And so there were many residents who came to the health department seeking guidance. They were losing their jobs, right? People were being evicted because they were African. Care providers were losing their jobs. And so one of the things that we created was a community health education in 6 different languages in just one of the wards. And Newark is very diverse. There's a rich tapestry of immigrant communities. And then there's a particular ward on the West Ward where, so it's a home to many Africans, African people from, different African countries. And so that was the first opportunity where I had to really build this bridge between the public health department, Health and Human Services, and the immigrant communities from Africa, to kind of just create this community health education in 6 different languages, right? And one was just to, elevate the awareness about how the virus is transmitted, right? And then B, to ensure that, living next door to someone from Guinea-Bissau or from Nigeria isn't necessarily going to cause you to have the Ebola virus, right? So just to eliminate the ignorance. And so that was very successful. The other, and this is a project that's always going to be the closest to my heart. And so as the health director, I was the CEO of the federally qualified health centers for City of Newark. So there's need for health everywhere, right? But then there's health need for women, primarily in this area of the South Ward of Newark. And so I had an opportunity to build a standalone women's health center. It was a comprehensive health center that had a birthing center, an opportunity for women to have mental health, dental care, group therapy, and to redeem voucher. So you would have children's health that's attached to the mother. And then an urban garden where their families could actually redeem the voucher but be able to have access to fresh produce. And that took not just the designing of the clinic, but also the planning and the designing and the menu of services that a mother can have conveniently just across the street from where she lived, right? And I think from the initial thought to the actual funding that came from HRSA, a generous funding, that's probably one of the highlights of my career at that time. Similarly, I think about how do I amplify, the work that I do among people of color, particularly girls, and if the opportunity is there, is to increase the pipeline of Eritrean medical students or graduate medical education or in public health. And so I served as the assistant professor in family medicine at Rutgers Medical School, And during the time I sat on the admissions committee, during my tenure, we increased the admission for people of color by 30% the first time. And it's not that big, right? So 30% from 0 is quite a bit, right? But it wasn't the admission alone, it's the retention, right? How do you bring them in and keep them in a way that they're serving the community long past, the residency program? So the idea of creating a medical village where doctors can live in where they were trained, right? So that there's this intimate relationship between the community and the physicians or the providers, right? So that's also something that I would highlight as an achievement. Just the opportunity to be able to open the doors from where I was sitting at the medical school.
Absolutely. While you're at it, actually, that um, opening the opportunity from the stage that what you're at, going back to your community and helping out the younger students or residents, like you said, particularly Eritreans. Have you had any connection and contribution back to your community, like as everyone else?
Oh, absolutely. And so one of the things that I don't get to teach as much anymore, but one of the things that I love to do, and it's an honor actually and a privilege to be able to I don't want to say co-chair because that that's quite a lot of work, is to be able to guide graduate students. And so over the last 5 years, I had an amazing opportunity to, I would say 8 years, to work with brilliant Eritreans, right? I usually try to co-chair or advise doctoral dissertations that are interdisciplinary between public health, and that tends to get into sort of the biostatistics. I love biostatistics, but I'm not a biostatistician. But if someone is interested in the impact of the social environment on health, I tend to kind of offer my my services, and just the opportunity to be mentored, right, and to have someone who understands how you're thinking about this. One of the first students that I advised was this brilliant doctorate and nurse practitioner student. I was at the time I was working as a senior research fellow at the School of Nursing at Rutgers, and she was completing her doctorate capstone. And I read the topic. It was mental health among Eritrean women. I mean, I could have jumped out of my seat, literally just for joy, looking for her. And then we had an opportunity to meet, and it's Dr. Sami Zarai, just brilliant woman. She did this exciting and really elaborate study of looking at how Eritrean women negotiate mental health, right? How do we talk about it? Do we even know what it is that we're feeling, and how do we know the feeling? So I served as the co-chair and the advisor on the sort of the statistics side of it, the analysis piece. And recently I had an opportunity to guide someone who was a visiting scholar from Germany, and he's looking at the impact of impact investment in community development on long-term health, like population health. And so that was exciting. My hope is that I can create a venue or an opportunity where I can meet more Eritrean youth, just to be able to advise. And I'm actually quite open to opportunities like that. I think we all have a certain level of privilege, and if we don't use that privilege to elevate our own community, then what are we really doing, right? And so and that comes again, sort of my earlier statement that I've been really blessed to have encountered strong women, and those are my aunts, the Eritrean women in my community, my mother's friends, and my grandmother, my mother, and so each one, although not in sort of like this professional realm, but they all had influence, and they've all supported the trajectory of my career. And so I like to pay it back.
So we just say that professionals' role, giving back to the community, creating a venue is an important role that you guys will play.
Oh, absolutely. And so I think that's a one sort of I don't want to diminish the impact of that. And so that's one element. The other is that I operate at the intersection of community development, economic development, impact investment, and population health. One of the sort of projects that I've been thinking about for some time, and then now it's gaining traction, is developing around community health centers, right? To the earlier discussion, I think community health centers are the answer to every community, period, right? I think not just the physical community health, but how you populate that, how, who you hire, who runs it, and who serves the community is very important. And so recently we're talking about it, some friends, Eritrean friends, and I are talking about selecting about 5 cities and just beginning to think of how to create a partnership among communities, financial development institutions, and community banks, and creating opportunities to own land, community land trusts, right? So that there's an opportunity to build affordable housing for Eritreans, to be able to open a community health center that serves everyone, but making sure that we have Eritrean staff and medical doctors who run and operate that, right? And so I think I'm very hopeful that, that first sort of community-focused project for me will happen in Atlanta. So I have plans, but my hope is that whatever education contribution and support I can give to youth, that's obviously one way you build the pipeline to Eritrean professionals, but then how do you, again, create an environment of wealth, home ownership, and an opportunity to access culturally relevant health, right, services.
I mean, I'm mesmerized. I can't wait to see it on the groundbreaking. It's an amazing idea, and it's something that we're going to be looking out for it, and of course involved as well. And all this, personally, how do you think your own identity as an Eritrean has impacted in a personal growth as well as a career-wise, your moral grounds? So being an Eritrean woman, how does that impact you in many ways?
Of course, great question. And so if there's anything that's a constant reminder or a palpable sort of an instrument that sort of guide us, it's the knowing of who you are and when you come, or where you come from, but more importantly that you have a home to go to. So first and foremost, when I retire, I'm going to Eritrea, right? When I retire, I will be in medical education, and that's where I hope to be. I don't know how long it's going to be, but when I do, that's that, right? And so that's my North Star, right? And to get there, I don't know that I can retire and not know that I had a cadre of health professionals that I've helped support, and open opportunities to. And the reason that I emphasize, helping Eritreans, wanting to advance our education, increasing the field of public health and community development, because I didn't have that growing up. I didn't see that, right? And so I always had to forge my own path. And, along the way, there have been generous, other people from sort of the Horn of Africa, be it from Ethiopia or Sudan. And so we're grateful for that. But I like it to be a norm to see a professor from Eritrea, a woman professor, right? In the way that, you can relate to and come to, and just, it's exhilarating. I don't even know how to describe that feeling. And so that's always been sort of my guide. And, at home, we spoke Tigrinya. Like my nieces, I have 12 nieces and nephews. They all know they're Eritrean. Their Tigrinya is probably better than mine, right? Because there's now this intentional insistence to learn the language, to read and write. Whereas with my family, it was just, we were first. We were the first generation, and it was, sort of just, how do you fit in, right? without losing your identity, you know. So we can speak English outside, but we weren't allowed to really carry on in English at home. That was a rule, right? And I think it's a rule that served us well.
Yes, I think many of us had that at home at Tigrinya as a rule. We can all relate that, and that worked very well for the first generation. And not last, but what would be your recommendation, or for the young Eritreans who are out there trying to make it to the professional level at any level, um, your word of wisdom?
Find your passion, right? Find the joy. I think we become successful, and I think there's this definition of success is very broad, but for people to find their passion and calling and pursue that, and to connect to other Eritreans, right? And use that to advance the community, right? I think there's a joy in finding what your purpose is, you know, what your calling. But if that calling and purpose doesn't advance who you are and where you come from, I think that's, I don't want to go too far and say that's a gift that's wasted, but it could be that, right? I don't want to be that dogmatic, but just personally speaking, I'm that much more fulfilled when I know that my education and my professional experience can also elevate the Eritrean community. And I hope that, you know, for the youth is to find that joy, that spark in their life, and use that, you know, to elevate the Eritrean community. How do you, I think there was a question that you said, like, how do you, you know, pass your expertise to young people, right? And so what I've done in the past is great, but I like to actually expand that, sort of amplify it in a more meaningful way, right? And so if there is a platform or an opportunity where students, you know, and obviously within the US context, right, that are looking for advice of how to get into medical school, right? So I would love to help with that. If there's an opportunity for someone to ask, you know, in greater detail of sort of this intersection in community development and public health, I would love to, you know, to speak to someone or serve as a guide, you know, and it's quite a relatively new field, right? Even, you know, outside of being an Eritrean, it's not often that you meet someone sort of in this sort of a corner of community development, finance, and population health. But so selfishly, I like to see more people in that field. And if there's an opportunity, if, you know, there are people, particularly young Eritrean women, interested in that, so happy to help and mentor that. And then about projects, and I think an exciting opportunity for me would be to work in a community where people want to increase home ownership for Eritrean women, right? Again, through connections, you know, through my work, we're able to, you know, I'm able to help forge that path. I know that it's very specific, and it's probably not how I thought, you know, I would take this conversation, but there are many opportunities to create health, right? And one, particularly in the American context, is how do you empower Eritreans so that they have full agency and ownership of their own health, and that means, you know, building the wealth, you know, owning their home, excelling in education. And so if there's an opportunity to do that in an Eritrean community, so I would love to be engaged and support that effort.
Definitely. Amazing. Well, Dr. Hanaa, thank you very much for having us and taking your time from your busy schedule. We appreciate it. Best of luck for all the upcoming projects and your many wishes that will be inspiring all of us as well. And thank you, EriXpress viewers, for staying tuned with us. Until next time.
Thank you so much.